Senate Majority Leader Harry Reid says he expects to bring legislation to overhaul the health care system up for debate next week. Will the bill pass in the Senate? Vermont Governor Jim Douglas has supported health care reform, but criticized the public option and the expansion of Medicaid. Governor Douglas joins us now from our Boston newsroom to discuss the outlook for health care and other issues impacting Vermont's economy. Governor, welcome to Bloomberg News.
Great to be here. Thanks for having me.
Governor, as we mentioned, you have some problems with the public option and with the expansion of Medicaid. Specifically, what are your concerns?
Well, the public option, I don't really believe that the government should get more involved in providing insurance than it already is. But the most troubling part for governors is the expansion of Medicaid and the lack of full funding for that in some of the bills working their way through the Congress. States are facing huge budget shortfalls over the next couple of years, cumulatively about $300 billion over the next 2 years, and we can't be expected to absorb a mandate from Congress to expand Medicaid. So that's an area of great concern, and we're going to continue to work with folks in the Congress to ask them to fully fund whatever they decide to expand.
Governor, could your state afford the overhaul that federal lawmakers are considering?
Well, Vermont has a very expansive Medicaid program now, so the impact on us will be a lot less extensive than it is in some other states. But I've talked with my counterparts in some states where the impact will be in the billion-dollar range, a very significant impact, especially when we're falling behind in supporting higher education, funding our pension systems, keeping our unemployment insurance trust fund solvent. We've got so many obligations during this recession that for the Congress to impose a mandate that's unfunded is going to be very difficult to assume.
Governor, do you know how many uninsured folks you have in your state right now? And if this health care plan isn't the right way to get them covered, what would be?
I think Vermont has a great answer to that. We have one of the lowest uninsured rates in the country, about 7.6%, down from nearly 10% just a couple of years ago. We put in place a program a few years ago called Green Mountain Care. It's not unlike the exchange that's being discussed on a national basis, but it provides greater subsidies for Vermonters up to 300% of the poverty level and an unsubsidized, less expensive option for those who are over that. I think there are some reforms in Vermont and other places that can really be models for America that do not involve an unfunded mandate.
Now, while that 7.5% figure may be admirable, do you expect to be able to even get that to be smaller?
Well, that's our goal. We want to get down to a very modest range, and we'll continue to do that. We've got what we call Catamount Health, a plan that was put in effect a couple of years ago. We also have a Healthy Choices discount that allows insurers to charge a lower premium for people who take certain steps, such as regular physicals, not smoking, getting regular exercise. The real goal of health care reform in our country, I believe, shouldn't be just to reshuffle the insurance deck and change how we pay for care, but to improve the overall health and welfare of the American people.
Governor, might I go back to the public option for just a second? What is it about that phrase and about that concept that is giving people cause for concern? The administration has said time and again that it is just that, an option. But opponents say that that is basically howling to the wind, because what's going to happen is so many people will opt out of their private insurance that they will go into the public option, and therefore that could lead to a public or a government takeover of the healthcare system. Do you believe that assessment?
Well, I am concerned about it. I think that's a legitimate concern. I think the better approach is a robust private market where there are lots of choices for consumers, different types of policies. One size doesn't fit all.
But aren't those choices too expensive, sir? Isn't that the problem?
Well, many of them are, but we have some new options in Vermont that are not, along with some subsidies for people up to a certain income level, and even above that, a more affordable option. I think that the marketplace works and can work in health insurance. So I think we should encourage more diversity in the insurance marketplace and not involve government in running more insurance plans.
Governor, could we talk politics for a second? Those elections last week, specifically the gubernatorial races in New Jersey and in Virginia, was that a referendum on President Obama, or was it just regional discontent, all politics, as you know, being local?
Well, the tradition is that a president sees his party lose ground in the first election after taking office, which ordinarily would be 2 years away. But the off-year elections suggested some rebalancing of American political thought. I think there are some local issues too, as well. That's what Tip O'Neill said in his book. All politics is local, and I think there are a lot of local issues that weighed in there. Obviously, the economy is on everybody's mind. Things are not good in most states in our country. Governments are cutting back on expenditures. Unemployment is high. Job opportunities fewer than they were. So there may be a general discontent with incumbency, and in both of those two states, the incumbent gubernatorial party was defeated.
Governor James Douglas of Vermont joining us from our Boston newsroom. Governor, thank you so much. We appreciate it.